Gotcha. Hey, everybody. Welcome back to this exciting episode of Black Beat Podcast, where we take an unapologetic approach to the media. And when it comes to those frontline issues that concern our communities, hey, look, we ain't holding nothing back. This episode is brought to you by Oregon Health Authority, working every day to protect and advance the health of all Oregonians, and by the University of Oregon, where students are inspired to innovate and driven to make a difference. Today, we're talking about something close to home for a lot of us, making sure that our kids, our families, especially those dealing with complex health needs, actually get the care they deserve. Whether that's in a school building, through child welfare, or just trying to navigate Medicaid, this conversation matters. And our special guest today, she is in the thick of it, helping lead the state's effort to support children, teens, and young adults through healthcare policy and practice. Please welcome Rusha Grinstead, Medicare's Policy and Program Manager at the Oregon Health Authority. Rusha, welcome to Black Beak Podcast. I'm excited for you being here today.
Thank you for having me, John.
So let's just jump right into this. You hear? No fluff, no stuff. Let's just go right for it. Now, I got to start by saying this topic is personal to me to some degree. Over the years, I've raised over 25 kids for the state of Oregon, mostly young Black African-American males, and I've seen what it's like to navigate the system from the inside. Talk to me. What are you bringing, Rusha? Can you walk us through what Medicare really does for families, especially when it comes to children and young people and their complex health needs? Tell us a little bit about what you do, and welcome again.
Yeah, so John, maybe let's kind of start with some of the fundamentals that OHP, or Oregon Health Plan, which is essentially what we call Medicaid in Oregon. And there's about 1.4 million Oregonians who are covered by OHP. That's 1 in 3 Oregonians that are covered by OHP. And 57% of Oregon's children are also covered by OHP. And the goal with OHP for the Oregon Health Authority and for all of us is really to make affordable healthcare more accessible, more available to all Oregonians, especially those communities in Oregon who have been historically marginalized, are still marginalized in a systemic basis. Wow. How can we center their journey, their experience to help us improve the system and make healthcare more accessible for them, affordable healthcare more accessible for them? And when it comes to young adults and children with special healthcare needs, these are individuals who have a combination of multiple complex chronic conditions like asthma, diabetes. These are individuals who have some kind of intellectual or developmental disability, or individuals who are eligible for receiving disability services. These are individuals who may have some kind of mental health need or neurodevelopmental conditions such as autism. So these individuals, they have a little higher need for services that can really help them maintain health and wellness. The young adults with special healthcare needs are 19 to 26-year-olds who may have one or more of these various needs and conditions that I just talked about. And that's what the young adults with special healthcare needs program under the Oregon Health Plan in Oregon is trying to do, is to provide coverage, healthcare coverage to these young adults who have a relatively higher need for certain services because of chronic conditions or because of behavioral health needs or because of disability, so that they're able to maintain access to the healthcare services that are so important for them to successfully transition from this pediatric care to adulthood, and so that they're able to maintain these services that they have been receiving, have been accessing, and not losing them as they transition to adulthood.
This episode of Black Beat Podcast is brought to you in part by the University of Oregon. Mighty doesn't follow trends, it sets them. Be mighty, be Oregon.
Okay, so let's talk about an example of that, right? What is like with some of the young people that I would receive, right, from the state, they would come in and they would have an assessment, coming with them. Some of them would come in with behavioral issues. Some of them would come in with a diagnosis like schizophrenia, things like that. They're young, say they're 16, 17 years old. They come into the system, right? And then at some point in time, they get to be the age to where they can move away from the system, but they still have these needs.
Mm-hmm.
So what is that? So is this saying that you track them? Do you have a continuum of services and cares that you case manage with them and you keep moving them through the system? Is that how, with something like that? So for parents and stuff like that, do they have parents at this point in time who have to track that with them? It sounds like it would be kind of complicated, a little bit complicated. How does that all work?
Yes, it is very much like that. It's all about helping those young adults continue access to their healthcare services that has been so critical for their wellness. And yes, absolutely complicated.
Yeah,
As you know, John, and we were just talking about this, right?
Yeah.
Like how complicated navigating the healthcare system is. So what we are really trying to do is making sure when it comes to the young adult and their families themselves, as little as possible burdening them with trying to figure things out. So those young adults who already have been on OHP, once they hit the age of adulthood, if they are still eligible for OHP, if they're eligible to be in the program for young adults with special healthcare needs, then they continue to remain in the system and continue to receive services. So what we have done is they all received a letter from us that says that this is your benefit now. You meet this particular eligibility, so you will continue to qualify and you will receive these comprehensive coverage because you are eligible under this young adults for special healthcare needs programs. There is also this other component where there may be young adults who have never been on OHP. Maybe they were on their parents' insurance before, or for whatever reason, they did not have healthcare coverage. So we are also engaging with communities as much as possible and trying to spread the word, make sure everyone learns that, hey, if you are someone who is 19 or 20-year-old and maybe you have some chronic conditions and you either don't have health insurance or you're worried that once you reach adulthood, you may not have health insurance, please look into the OHP application. See if you qualify as a young adult with special healthcare needs. You might be eligible to receive OHP as an individual who needs these very specific services for your health.
Rusha, how has that changed from, say, what's the chronological like? I mean, what's the transformations or the changes within this structure? Like, say, if you look back 20 years ago, what's different about it today when you're looking at the same related issue 20 years back, moving to today? How has that evolved itself? How has this structure evolved itself?
Yeah, in terms of terms of the structure and the system in which young adults and children are receiving OHP covered services now, we have something called EPSDT, and it's early periodic screening, diagnostic, and treatment. And it's a mouthful of letters. It's a mouthful of letters. But what it essentially is Medicaid for all individuals who are under the age of 21.
Gotcha.
And what is really cool about it is that um, all individuals who are on OHP, and this EPSDT does not only exist in Oregon. All states have this for children who are covered under Medicaid, is that if you are a child or if you are an individual under the age of 21 and you're covered by OHP, you are eligible to receive all medically necessary and medically appropriate services.
Wow, I didn't know that.
So a very comprehensive coverage of services that a child or a youth or young adult may need. It is covered for them under their OHP plan.
Wow.
With the young adult with special healthcare needs, what it does is those who qualify for this specific program, they are able to receive that comprehensive level of coverage up to the age of 26.
Wow. Wow. So that's kind of special. So you mean to tell me Medicaid has a special type of insurance support plan that would allow people after they've turned to a young adult at past the age of 18. So in between this magic number between 19 and 26, they literally can just qualify for some services to allow them to be supported, whatever the transitional needs are. Huh? Is this ongoing even it passes 26 once they, if that diagnosis maintains with them past 26, does that mean that they can keep it past age 26?
So, young adults with special healthcare needs, this year when we launched the program, it is inclusive of 19 and 20-year-olds. And these 19 and 20-year-olds who would have otherwise transitioned into OHP for adults, they continue to receive the same OHP that they were receiving as a child if they qualify as a young adult with special healthcare needs. However, when these 19 and 20-year-olds reach the age of 21, they don't lose that comprehensive coverage. They continue to receive that same amount of comprehensive coverage up to the age of 26. And after the age of 26, it is not the same EPSDT coverage anymore, but if they qualify for other eligibility benefits under OHP, they will transition into that.
Wow, wow. And does the family, so do they have to have claimed some independence of a base like a family or anything? Are they standing alone, or do they have families also and be able to qualify for these services?
Yes, it is whether individual or family income up to 205% of federal poverty level. Wow. And then these individuals, if they meet the other chronic conditions, disability, and diagnostic requirement, then yes, they will qualify.
So you're looking at numbers a lot then, I take it. Huh? But now let's I understand this program moves with the students and young people. Tell us about how this program manages to go into the schoolhouse and follow, through these educational structures. What's that merger like? Tell me a little bit about, how these services they are actually able to get into the school buildings and the schoolhouse and be able to serve young people. How does that synergy happen?
Yeah, so just like Medicaid in general, and you may already know this, especially given your experience a lot with being in the system and with your kids, helping your kids, all of that.
They just keep coming.
Right. So in the school setting, there is a way for schools to be able to participate in Medicaid, especially for those students who have individual education plan, or what we know as 504 plans, and all of these rules that are, and the coverage that are part of EPSDT, YSHN, or young adults with special healthcare needs, they still apply in that school setting. So a school that's participating in Medicaid and providing services to Medicaid covered kids in their school so that these students are able to participate better in their education, that same level of coverage also still exists and applies in the school setting.
Now, is there a process that students who are still inside the institutions, whether schools, rather if it's corrections, wherever that institution is there a sort of a program synergy? How are they are the institutions a place of identification of need? How does that all work? Do you have a practitioner placed in the school systems, or do the school? How do you identify the patients or the people, the recipients of the service? How does that work?
Yeah, so I can speak to the school setting for sure. When it comes to schools, they can participate directly in Medicaid.
Mm-hmm.
And what the school is able to do is services that they provide to students in the school setting. And this can be, if like through school nurses or if the school employs or contracts with an occupational therapist or a speech therapist, then they are able to be reimbursed by Medicaid if they're participating in Medicaid. And in those cases, what we would do as the state Medicaid agency is work directly with the school district or the school and provide them with the technical assistance, provide them with the support they need to be able to participate in Medicaid.
Wow. That now has that changed over the years? Was that always in place that way through the schools, or did within the last 10 years, that has been a newly added element of service while people are in schools and institutions?
In the school setting, this has definitely been for a while. And over the last few years, there has been improvements in the system and expansion of the program. And not only in Oregon, across the nation.
Wow. So let's deviate a little bit even more. Let's talk about the child welfare, the systems navigations, right? Now, one of the most difficult parts as being a person, a foster parent or a surrogate parent or however, is that historically BIPOC communities have always had a phobia toward the white cloth or services and being able to what is this system doing at this point in time? And I don't know if your job would include this. How is it dealing with BIPOC communities who have had a historic resistance toward services such as this, rather if it's medical? Is there a special push or an effort to be able to navigate that complex system?
Yeah, so that's a great question, and as we all know, there are multiple reasons because of which there is a distrust from BIPOC communities when it comes to trusting healthcare that comes from any kind of government system. Multiple historic reasons there, and at the Oregon Health Authority, we definitely are staying true to our commitment to remove barriers, to eliminate inequities when it comes to accessing healthcare by 2030. And one of the most critical components of being able to do that is to center the engagement and trust building with the communities that we are working with. And the work that we are needing to do the most and is ahead of us as a state overall is really building that trust back with communities of color.
How are you doing that? How does that work? You got an example of how y'all doing that?
Yeah. So, for example, all of our policies that we are developing, and the young adult with special healthcare needs, I'll give you that as an example. As we have been building out this program, we have consistently engaged with various regions of the state and spoken directly to young adults themselves through like focus groups, through engagement groups. And it has not been just one and done. It has been a consistent process. And we are continuing to do this as we monitor the program, that what's working, what's not working. Even when we developed the administrative rules that regulate these programs and has oversight on these programs, those all were created through direct conversations and feedback from our community members who will be directly impacted by these policies.
Yeah, I mean, because, I remember having to present to the state's psychiatry board here, and and looking at 25 years back, is that most African American communities, whenever they seen that white robe, they go the other way. They, we ain't go what, even your mom and your daddy would say, "You boy, you don't need to go see them people, right?"
Yeah.
And so while talking to them, though, the question was, how creative can they be to be able to sort of mitigate some of those complications? And could they take the white robe off and go shoot a basketball and do an assessment? Can you go to their homes and eat their food and share in their environment at the same time, be able to engage in the things or get the things out of that observation or evaluation that you needed? So a lot of them were really voluntary to be able to do that. Or is Medicaid looking at, are they using creative intervention ways to be able to reach these demographics and things like that? Or are they just doing status quo, like, the normal outreach that they do? Or are they really trying to challenge that structure and be able to move into those communities?
We are always trying to do things in innovative, creative ways because, as you know, that's what Oregon always does. And when it comes to Medicaid, one of the ways that we are always trying to be innovative is really, again, like listening to our community and listening for where are some spaces we have not been able to provide support, and how can we provide support in those places. And that can look like something like a peer that works with a young adult or a child or their parents and really helps them navigate the system, or is really helping them just to make sure, hey, you keep your appointments and here are the things you do to make sure you stay involved and engaged in your treatment. And through Medicaid, we are able to reimburse for the work that these peer support specialists are doing. And what it does is it really creates a person and family-centered approach where it's not only clinical individuals or clinicians who are being part of the wellness journey of any individual or family, but there are also these other individuals who have similar lived experiences and also have experiences that they can teach to these families and individuals on how to navigate the system, how to stay engaged in their therapy or treatment or whatever it is, so that they are able to meet that goal of getting better, and whatever their health goal is, they're able to get there.
Right. And I think in a big way, learning to mitigate trust. Or reestablishing a trust. I mean, because you realize these demographics has historically been mistreated throughout a lot of these processes. I mean, you can go as far back as you like. I mean, experimentation, so on and so on, that have historical relationships to why these BIPOC communities don't trust these medical systems, institutions, and things like that. So it's really great to see that you guys are really trying to somehow scale that, and to be able to understand that that's an element or a necessary element for us to be able to get advancement in these processes to be able to mitigate some of these high-risk situations. So, Rusha, I really do appreciate that aspect of the work that you guys are doing, and so and thank you for that. I think one of the parts that are really kind of the question that I'm having for you is where do you see some of these spaces at, that you yourself, being somebody that is and I love this word, epidemiologist. I always fall over that one, a little bit. I look at it for the first time every time I see that word. I go, what does that mean? And I hear it 100 times, and that is you're tracking the work. And what are some of those special things that you're running into that you'd like to share with our listening group that perhaps I haven't asked you about and perhaps we haven't touched on in your role as the things that you do? What are some of the things you would like to point out to our listeners that really matter to you as someone who has been tracking this stuff and been working with it and working through it? Can you share a little bit to our listeners as to what that is for you?
Yes, absolutely, John. So right now I don't work as an epidemiologist anymore, but my education has been in that space and in that subject. But I will tell you how I bring that into the work with Medicaid in reaching our children and families and young adults that I do is looking at the numbers and the outcomes, right? And when I say that, what I mean is who is accessing services, who is not accessing the services, and who is, and even further, who is seeking the services, and if they're not, why are they not? And then really being able to engage directly with those individuals, with those families, with those communities, to be able to understand why are they not, what are the barriers that is in their way, and how can, as the state Medicaid agency, as Oregon Health Authority, we can improve our policies so that we are creating a system where everyone is able to access that affordable healthcare in an equitable way, especially those who have had way more challenges compared to others. How can we remove more of those barriers from their way so that they are building more trust towards the system and are seeking services? And when they're seeking services, we're not making it so difficult for them that they can actually access the services. And another thing that is really important for me personally, and as an agency as well, is being able to access culturally appropriate services. As a BIPOC individual myself, I know that's very important for me. And even in my own personal journey with my healthcare, there have been many instances when I may have stopped seeking a service simply because I was not able to get someone who I'm connecting with at a cultural level, and they're not able to connect with me as a human at that level. So it's very important for us to identify any ways, like you said, creative ways, innovative ways. How can we give people access to those culturally appropriate, developmentally appropriate, linguistically appropriate services?
Right, and they're out there. The question is, how do we bridge that gap of the reasons, the risk factors of why people don't access those services. And so my listeners out there, y'all need to hear this. For years, I don't know if most of y'all don't know about it, but Mama and them we always knew who had some issues when we was growing up with the young people that we was playing with, right? I mean, we recognized that Anthony over there wasn't as fast as the rest of us was. We never said anything. But when we went home to Mama and we said, Mama, Anthony don't seem to, well, yeah, he all right. Y'all just keep on playing with Anthony. He'll be just fine, right? And then Anthony, about 30 years later on, Anthony, full-blown mental health, he out there on the street, can't quite figure out how to navigate his way back, but I believe that a lot of that was reinforced by us because of the fact that within our communities, we didn't have the trust to send our young people outside of the community to these places where they can get help, services, all that kind of stuff. So I would encourage y'all today who are listening to this podcast today, Rusha has come with a plan. She's bringing some high intensity, y'all, to the services that are available out there to y'all. So you'll need to be checking in with these here services and figuring out how to access them because they are available to you and they're not foreign to you. They don't want to push you away. They want to receive you. So, but sister, I do appreciate you coming on to the show today and being a part of it. And for me, usually at the end of these, as a reflection, as we've gone through the process for a little bit, I usually ask my guests as to consider, think about it for a second, is to perhaps what things were not said here that you would like to have shared with our listening population to share with them some of your thoughts about some things that we didn't talk about.
Yes, absolutely. I would say please go look up the Young Adults with Special Healthcare Needs programs on our website. We also have a way for people to give us feedback, ask questions. All of that information is up there. If there are members listening who are members that belong to a coordinated care organization and that's how they receive their OHP, reach out to your coordinated care organization. They should have received a notice from their coordinated care organization if they are eligible for young adults with special health care needs. But yeah, just reach out, look up the program. If you want to find out whether you qualify or are eligible, definitely go to our OHP eligibility website to see if you are eligible for OHP or for young adults with special health care needs program.
Sister, right on. I've really enjoyed you as our guest today. And to our listeners, this episode wasn't about policy. It was about people. It was about kids who deserve to be seen, heard, and cared for. And big thanks to Oregon Health Authority and the University of Oregon for supporting this episode. Until next time, keep fighting, keep loving, keep showing up. This is Black Beat Podcast, and thank you.
Thank you, John.
Yeah. We out, y'all. Today's episode is brought to you by the Oregon Health Authority, coming together for change, because when it comes to health, we're all connected.